So we are all set for the evening, and I would like to start this session by a very famous saying of Einstein, that is, intellectual growth should commence at birth and ease only at the death. So good evening to once again to all of you. Today I would like to welcome our very esteemed guest speakers, Dr. Bharatendra and Miss Monika Wahi, for the session. Welcome, sir. Welcome, ma'am. And our faculty moderator, the Shiv, sir. So now over to you, sir, because today is our, so that you can welcome our guest speakers.
Thank you very much. A very good morning, evening, good afternoon, depending on from where you all are joining. On behalf of IIHMR University, I extend this formal welcome to our esteemed panelists, Dr. Bharatendra and Dr. Monika Wahi. And I also welcome all the participants participating from different parts of the world. This session is especially significant because first thing, we are touching such an important theme, that is AI applications in healthcare. And second, that we have two wonderful experts with us. Dr. Bharatendra K, who is also chairperson of the Decision Science Department at University of Massachusetts at Dartmouth. And he has a very good experience in reliability, quality, along with artificial intelligence, so that gives a unique combination. We have Ms. Monika Wahi, who is having a rich background in public health and then in technology, biostatistics, and this makes the combination wonderful. I'm sure that next couple of hours are going to be power-packed with a lot of learning. Thank you so much for accepting our request and joining this. Once again, I welcome you all, and now rest over to the panelists for taking the workshop forward. Thank you very much.
Thanks, Dr. Tripathi. Today I'll be talking about AI for healthcare. My name is Bharatendra Rai, and I'm from University of Massachusetts, Dartmouth. So, as the name suggests, this university is basically in Massachusetts. And like as far as COVID is concerned, so compared to other states, I think Massachusetts is doing really well. So used to be like in thousands, now it's like in, I think, a couple of hundreds. So that's a good news. So I have been with this university for almost 14 years now. And I used to work at Ford Motor Company before this as a quality and reliability engineer. And before that, I was a faculty at Indian Statistical Institute. So in fact, around 89, I was in Jaipur. So that's long back. And my father was in army at that time, and he was posted in Jaipur. So I was doing masters, and I used to frequently visit Jaipur. So very nice city. I still remember. So I see actually right now around 107 participants, so 100 plus. So actually this is very pleasant surprise because just before this COVID things started happening, I went to a conference in Los Angeles. And as you know, like we make presentations about our research papers and things like that. So when I went to the room where I was designated to make a presentation, I saw there was only one person sitting in the room, and it was bit shocking, but I have seen like it happens in big conferences when you have so many parallel sessions. So I was at least happy that at least one person is there. And before starting my presentation, I thanked him that at least he showed interest and he came to listen to my presentation. So he said, actually, I'm the next speaker, so you don't have to thank me. So, but 100 plus, I think that's a very good audience. So I'm so happy. So let's go to the agenda or the outline of my talk today. So I'll start with very basic things like what is AI, what is machine learning, data science and how they are related. And then I will also cover some case studies that I was involved in and some other case studies that we are working on. We also look at CRISP DM process. So CRISP stands for Cross Industry Standard Process for Data Mining. And because this is a workshop, not a seminar where one person speaks and other people just listen. So second half of this presentation will be mostly like hands-on. So participants will get a chance to work on COVID data. We'll do some very basic visualization and then do maybe forecast. So that's the broad outline for today's presentation. And I think I have time till 10, but I will try to finish maybe a few minutes early so that if somebody has questions, we can discuss that. So I like to start with the first part, which is what is AI, machine learning, and data science, and how they are related. And this is a very popular picture you may have seen earlier also. So where you have this artificial intelligence as a bigger umbrella, and within that, the subset of AI, there is a machine learning, and then there is a subset of machine learning, which is a deep learning. So AI, as you know, like the words are artificial intelligence. So this is not a new terminology. It has been there since 1950s. And intelligence basically relates to human beings. So at least because right now we rule the world. So we choose to decide that we are intelligent. And artificial intelligence specifically refers to machines that adopt, like they get some kind of intelligence by doing certain things. So there are a lot of examples you may have come across. I will just very quickly quote one study that was done with Facebook, because many people use Facebook. And this study found that if you have data on 68 Facebook likes of somebody, you can predict skin color of that person with 95% accuracy. So, and in fact, with the same data, people can also, like, obviously not people, but machines, they can accurately classify somebody's sexual orientation or political affiliations with 88% accuracy. With 10 likes, you can evaluate persons better than interviewing a coworker. With 70 likes, you can outperform, machines can outperform friends who thought they knew about him or her. With 150 likes, the machines can do better than their parents. With 300 likes, the machines can uncover things that even their partners did not know. And with data on more than 300 likes, they can outperform person themselves. Like what I know about myself, with 300 plus likes, machines can do better than that. So nowadays, like smartphones are so common, and smartphones are more or less like questionnaires, which everybody is filling almost on a constant basis. So artificial intelligence is becoming very popular, and especially like nowadays, there are some leading things that are happening. And one of them is self-driving cars. So I'm sure you have heard of Elon Musk's plan of having cars without steering wheels. So cars that can drive themselves. And the problem he's trying to solve is very very big in a way, because the cars that people buy, as per a study, we use the car only 4% of the time. 96% of the time that car is either parked somewhere or just idling. So self-driving cars obviously can solve these problems of traffic jam, pollution, and things like that. So that's like a broad example of AI. What are the things that are happening? Now, machine learning, the word machine is basically a computer, and learning happens with data. So we provide a lot of data to algorithms, and those algorithms can find a way to do certain things that usually are done by humans. So there are so many examples like face recognition. If you go to Facebook or Google Photos, they are able to recognize faces. Deep learning is, again, a subset of machine learning where mostly people make use of deep neural networks. So neural networks with several layers in it. So there are many examples of that also, and we'll also look at one or two examples. So this is an example about use of artificial intelligence for solving breast cancer related problems. So computer vision is used here for medical image recognition. So just like algorithms are able to recognize somebody's face, so similarly, they can recognize certain images and detect whether or not there is a problem. And the algorithm that was used by Google here is deep learning. So they used very deep neural networks. And the accuracy that was obtained by pathologists who are specialists in dealing with these kind of images was 73%. And the AI system was able to improve it in less time to higher accuracy of almost 89–90%. Another example is regarding patient appointments. So this is a very common thing that there are times when there is an appointment and then the person doesn't show up. So this study was done with 22,000 MRI appointments, and the AI tool was able to identify 90% of the patients who may not turn up for a given appointment. And with that, obviously, if you are able to schedule somebody else, so they were able to save close to $1 million per year with this one application. There are three major areas that we see when we look at like AI examples. So one example that we just saw was AI in medical imaging. And typically it makes use of deep neural networks. And then we have like AI involvement in healthcare communication. So communication is a very important part of healthcare. And it could be written communication or audio communication. So managing that data in a smart way. So that's second key area in healthcare. And there are also a lot of medical dosage errors that happen. And in fact, there's a big opportunity there for AI systems to help and reduce those kind of errors. So in fact, this study also reported that AI health market is projected to grow more than 10 times within next 5 years. So that's obviously a lot of opportunities for people working in this field, and also for like students who are trying to build a career. So they will also see this as a very positive thing, that there will be obviously more jobs because of these changes. Now coming to AI and machine learning case studies. So before we go into that, this is a very standard definition of big data that you may have seen. 3 V's: volume, velocity, and variety. So when we are dealing with big data, there is a huge volume of data. Some examples, not from like healthcare, but other places are like transactions at, let's say, Amazon. So every second there are thousands and thousands of transactions that happen. It comes with a lot of velocity in real time. Just like if you go on Twitter, you see tweets coming from all directions. And then there's a variety, and the type of data that machine learning use or deep learning algorithms use could be structured or unstructured. So structured data is estimated to be around 5%. The typical data that we come across, let's say Excel file, nice rows and columns. So that contribute only about 5%, but 95% of the data is unstructured, which could be text data, like in healthcare, it could be transcriptions. It could be audio data, like recordings of a doctor. It could be video, it could be images, and so on. So one thing usually I also like to point out is that these AI systems or machine learning systems, they are trained to work only with the structured data. So data that are in nice rows and columns, they are not for unstructured data. But the thing is, in unstructured data, we have so much of useful information that somehow we need to use that. So before this data can be used, you will find that most of the algorithms are designed in such a way that before you can use a particular method, you have to do a lot of pre-processing of data. So basically some kind of preparation of the data before you can use a machine learning or deep learning algorithm. And what that extra step does is very simple. So that extra step basically converts unstructured data into a structured data so that we can make use of those methods, machine learning methods or statistical methods that we use. So even if we have a text data, so text data has to be first converted into some structure. We cannot use and apply these AI algorithms directly on a text data, but we have to first convert it into structure. We have to give some structure to it. So one example is like we are working on a paper where we are looking at transcriptions, and the response there is speciality. So feeding the transcriptions, it could be audio or text. We should be able to classify that automatically into one of the specialties. And for doing that, the first thing we have to do is we have to convert that text data into some kind of numbers which are more organized, and then work with that. So there are a lot of big data applications all around us. Like if you look at sports, NBA is very popular in US, so basketball. And we have this smart basketballs which are like embedded with more than 30 sensors. And when these players dribble the basketball and take it around from one place to another place, so all the data, all the movements, everything gets recorded, and that is analyzed to improve the game. It could be a player or the team, and so on. Health is obviously one of the big areas in AI and big data applications. And all the big players, if you look at like Apple, so when they came out with the Apple Watch, so health related things were one of the major attractions, or basically design features of Apple Watch. Homes are smart nowadays. You can switch off your lights, for example, or you can program your air conditioning or heating systems remotely. Cars are very smart nowadays. If you compare like today's car with the Model T, Ford's Model T, so obviously there's a huge difference. In fact, even love is nowadays smart or intelligent. There's a story about this lady who went on a date. She went to a very expensive restaurant for dinner with a guy. And once the dinner was over, almost over, so this guy told that lady that, give me a few minutes, I'll be back from restroom. And he went and did not return. So this lady was very unhappy. And so it affected her so much that she started basically a new company where basically a male and a female are paired based on more than 25 different like metrics. So that many metrics have to match before they can go on a date. So this company is now called eHarmony, and she was the founder of the company, and I think she's also the CEO. So all this smartness or intelligence that we see in machines or computers or phones. So if you look at 1960, this is an IBM's mainframe computer. And there are two scientists operating it. And it's a big room and a lot of big equipments. Today, the smartphone that we have in our hand is much more powerful than the supercomputer that we had in 1960s. So that's what has made AI possible, AI applications possible today. So let's look at first case study. So this case study was done by one of my PhD students. She graduated in December last year. And her focus of her PhD was healthcare analytics. And this paper is about user-independent detection for freezing of gait in PDs or Parkinson disease. So as you know, Parkinson disease happens sometime in old age, and freezing of gait is a problem in old age. So freezing of gait can cause a person to trip and fall down. And after like somebody who is like 70s or 80s, a fall can make things very difficult. So sometimes somebody may break their bones, and the healing is very slow in old ages. So it is a big problem, but another problem is that there's no cure for this. There's no medicine available that can take care of freezing of gait. So what happens is what can be done is like if we can predict even a fraction of a second before this freezing of gait happens and alert the patient through some system, so that fall can be avoided. So we made use of a random forest algorithm, machine learning algorithm for this. So what we did was the data was collected like this. We tied sensors to ankle, upper thigh, and trunk. And there were actually 3 of them. the data was being collected on a horizontal acceleration, vertical, and horizontal lateral. Response was whether there was any freezing or no freezing. And this was labeled by the physios. So after collecting the data and creating a random forest model, we created this confusion matrix that we do. So this is the actual class 1 and 2, and these are the predicted class on the left side. So actual 1 and predicted 1 means actually there was no freezing in the patient, and the model also predicted that there will not be any freezing of gait. Similarly, there was 796 cases where actually freezing of gait happened and the model was able to predict. So on the diagonal that we see, we have correct classification, and off diagonal, this 44 and 13 are incorrect classifications. So the idea is to minimize off diagonal items or numbers and maximize the numbers on the diagonal. So if we can develop a machine learning algorithm that can do better than this, so obviously that model is better. So usually when we apply machine learning methods, we don't apply only one method, we apply many methods and then compare them and select the one that gives best outcome. So misclassification error was about 0.45. So accuracy level was about 99.5%. So we calculate that by adding the diagonals and dividing it by the total. And when you do 1 minus, you get 0.45%. Another application is deep learning. So this is from one of my chapters in the deep learning book that I wrote recently. So there are 21 independent variables in this data set. So this is more traditional data. Like you can classify this towards like structured data. And this is a CTG data that we get. And response is N, S, or P. N is normal, S suspect, and P is pathologic. So we developed a deep learning model, and one problem that you see in this bar plot, so the proportion of cases that are 0 or normal are almost 80%. So when we deal with big data and we try to develop artificial intelligence applications, I'm sure you hear a lot about misrepresentation of data in some ways. The algorithms sometimes get biased. So there was a popular actually deep learning algorithm which was applied to pictures. And the problem was that somebody who developed that algorithm used mostly data from people whose skin color is mostly white. But when new data was given to it, like people with black skin color, so algorithm classified them as gorillas. So obviously the model which doesn't have like balanced data, or if this unbalancedness is not addressed, you get very strange kind of outcome. So this data is highly unbalanced. You can see 80% of the cases are normal. And in healthcare field, this is very common, that most of the times the normal data is much bigger than abnormal data. Suspect data is about 10% and pathologic data is less than 5%. But the good thing is when we use these deep learning algorithms developed by Google, TensorFlow and Keras, they have a mechanism to address this unbalancedness. So we did that, and ran it for 20 epochs. And you can see accuracy is at the top, loss is at the bottom. And the red ones are for training data and blue ones are for validation data. So we do not see very huge gap between the two. Otherwise, we have to be very careful about overfitting when we are doing deep learning. But this outcome was okay. And this is the class confusion matrix. And you can see that this algorithm was able to predict normal, suspect, and pathologic cases with 78, 79, and 84% accuracy. So it may not be like these numbers may not look very high, like not 99% or over 90%. But what you will notice is that in spite of the normal data being 80%, it is not really dominating. It's not that the accuracy is the highest for only normal and too bad for pathology cases. So in fact, this outcome is very, very consistent. It has done a good job in balancing the three classes as far as like the outcome is concerned. Another example is NLP. So apart from like computer vision and audio applications, NLP is another big area in artificial intelligence. And if you look at examples all around us, like Siri or Alexa, Amazon's Alexa, so it can talk to you and it can answer like very basic questions that you may have. I don't know whether they will be able to pass the Turing test that was designed in 1950s, where the machines are able to talk like human and you cannot like detect any difference between the two. I met a professor actually from a computer science department at one of the conferences. I think it was IBM's conference. And he had a big class and he was assigned 12 TAs, teaching assistant for his class. And because of the popularity of the class, the number of students who enrolled was bigger than expected. And he asked for one more TA and his request was denied because of whatever reason. So college mentioned that like we cannot afford like one more, we already have 12. So what he did was he created TA, which was a virtual TA, like not a real TA, but a computer program. So when a student sends an email, this algorithm will basically apply. So it was trained on all the interactions between TAs and students for past several years. So he had all those data and he fed this into this chatbot, and he was able to create artificial intelligence kind of a TA. And it just happened that after the semester was over, and I don't remember the name of this virtual TA, but basically he named it after a girl. And one of the students, he was trying to interact with this and asking for like going for a date with her. So I'm sure like that would have passed the Turing test, because even the students were not able to figure out that this was not a real person, but it was just a bot. So NLP actually, those of you in the audience who have plans to do PhD or you're doing PhD, this is one big area of research. There's a lot of opportunity. There is very little that has been done, but there is so much of work yet to be done. So this is a very, very hot field for a lot of things. And especially in healthcare, there are a lot of opportunities for somebody working in NLP area. So the data here is medical speech. So it's audio data. And the response is basically, it gets converted into common symptoms. And you may know that when we work with text data, because this speech will be converted into text, from text to numbers, giving it some kind of structure before we apply deep learning methods. So one of the popular methods or models that we use in deep learning is LSTM, long short-term memory. And basically, it doesn't look at each word as it is, but also tries to retain linkage between the previous words and try to connect it with the latest words. So some kind of time series. So because most of the other methods, they have a problem. Like, for example, I have given 2 sentences here. I like to eat chocolates. So basically, like and chocolate has some connection here. But in sentence 2, like and chocolates are separated by a big distance. And many of the other methods fail whenever 2 words which are supposed to be related are separated by a big distance. And LSTM basically solves that problem. Another thing that we come across is these medical speeches or transcriptions may not be equal in length. There may be some which are only like 50 words, but there are some which are 2,500 words long. So that's another thing that we tackle when we work with NLP. So we have this concept of padding or truncation. So we do the padding if, let's say, if we fix a number as 1,500 and we have only 500, then the other 1,000 for 1,000 words will just add zeros. So that's called padding. And if we are targeting 1,500 but we have 2,500, then we truncate. So we cut either at the beginning or towards the end. So that also we can control and bring it to 1,500. So before we can apply LSTM, we make sure that everything is exactly equal in length. So this was the outcome, where there are like 50 different symptoms. And you will see that the algorithm is not able to classify everything with high accuracy. So you have one case like symptom number 15, which has very close to 100% accuracy. But then if you look at 49th symptom, so that's like almost 10%. So there's a huge variety. And obviously this may not be the best model, but it needs to be improved. Okay, so this is a popular CRISP model, cross industry standard process for data mining. And in fact, in industries, when people apply these methods, they go through these 6 steps. So I'll not spend too much time on this, but I think one has to be familiar with these methods, especially like if you are applying this method, one should know the process. In fact, the case studies that I showed, I try to put them under these headings for completeness. So when we studied all these methods, when we are looking for jobs, what people are looking for are basically somebody with experience in 3 major areas. If you are working with in artificial intelligence area and learning machine learning and deep learning methods, you must have a very solid understanding of basic statistics. So that's still important. So although we do a lot of machine learning, but we also do a lot of statistical tests. I'm sure like you have heard words like analytics and analysis. So in data science, remember that machines do analytics and humans do analysis. So machines do analytics, but obviously under our guidance. So So far, they are not like, they are still AI, where AI is mostly narrow AI. And it can do one specific thing. Like if you ask question to Siri, it can reply to you. But if you ask for a coffee, it's not going to serve you a coffee. So it's not a general AI. It's not AGI, which is artificial general intelligence. But people obviously have dreams of going towards AGI. But whatever skill set you're developing, statistics should be part of that. Hacking skills is mostly ability to do some coding. So I do most of my coding in R and R Studio. So that's my hacking skills. And subject expertise, if you are working in healthcare, so obviously when you spend a lot of time, many years, so that expertise will come to you. So once you combine all these three into one, so that's what makes somebody very strong. For machine learning, I have created this playlist of top 10 must-know machine learning methods. So if you are in this field, or if you are doing PhD, or if you are looking for jobs, so this could be, this list could be very useful to you. So make sure that you understand the basics and you are able to run these algorithms in certain way. So out of three major things that somebody needs to be successful in life, I think reading is one of the most important things. And I treat reading as like number one. And I read a saying somewhere that people who don't read are no better than those who can't. So reading, I think, is number one in my mind. Second one, obviously, is traveling. So two books that I have listed here. One is AI Superpowers. So how China is beating the world. Actually, China is well ahead of many other countries when it comes to artificial intelligence. And this book actually provides a lot of interesting cases and examples that you may find interesting. So this is like a regular reading book. You can read very easily, not very heavy duty, but just a light reading. But if you are looking to develop some skills in deep learning, you can make use of advanced deep learning with R, which basically each chapter is an example where you start with the data and the end result is like how you arrive at your conclusions. And for jobs, I just Google healthcare. You can combine it with data or analytics. And in US, I see like a lot of entry-level jobs. And Massachusetts specifically, the number one in terms of like providing jobs, the number one field is healthcare. So the most of the people, the maximum number of people are employed in healthcare related jobs in Massachusetts. And in future, it is likely to grow because people are living longer, and that will create more and more interesting and new needs. And many of these jobs that I see, healthcare data analysts, for example, they require you to know some algorithms like R, R Studio, or Python. Python, I have seen, is mostly used by people who work in computer related fields, and R is mostly used by people in business. So that was a quick overview of my presentation and some examples. And any questions?
Hello.
Yeah.
Thank you. Yeah, thank you so much, sir, for the wonderful insights on data healthcare. Sir, I have few questions.
Yeah.
My first question is ki, as we know that soon India will be launching its coronavirus vaccine.
Yeah.
So, sir, can you please elaborate that? Can we predict with the help of CRISP-DM technology or some other data-based technologies that will the vaccine will be? I mean, it will be helpful to, to cure the coronavirus or not? I mean, the CRISP-DM technology is helpful in clinical trials, or we can use it only for the on the data sets that we are having.
So I'm assuming that like people who do studies and come out with vaccines, they use data. And whenever or wherever data can be used, these methods like machine learning or deep learning, so that can be used. One thing I would like to point out is like, especially deep learning models, they require lots of data. And just as an example, like face recognition. So it could be a picture of a person, or it could be a picture of like, as the example I showed you for breast cancer. So you look at some pictures and then the algorithms are trained to find some, like there's a method called anomaly detection. So if it sees that, okay, these are normal, and suddenly it finds a picture which is very different from what it had learned to see, then it will raise a red flag and say this is not normal. So with any disease, most of the times, like people are normal when something is tested, but a small percentage when they are not normal, that's what algorithm can help to detect faster than human beings. The reason is like human beings get tired, and if they have, somebody has to go through like so much of records, like in US, if I take example of like mammograms, there are more than I think almost 20 million mammograms are done every year, and somebody has to go through a lot of like data and see where there is a problem or if things are normal. So those kind of processes can be automated very easily by providing a lot of data, because even 1 year of data, like 20 million, is a lot, and it can learn very fast. Just like Google, for example, it is able to do speech translation so easily because it has been fed with so much of data that is available. So I'm sure like COVID also, when you have a lot of data available, so instead of like human beings going through like tons of data and trying to figure out what's going on, you need some computing power to work with that and come out with some outcomes.
Thank you, sir.
I definitely see the methods being useful there.
Okay, thank you, sir. My second question is how the algorithm of CRISP-DM are different from the blockchain algorithms?
So blockchain algorithm is a different mechanism. Like there is like parallel processing, and also like many other things are there. So deep learning and machine learning, these methods, see, every algorithm is different. So the way LSTM works, the way GAN works, or the way you have these CNN, convolutional neural networks. So every algorithm is different. And CNN, for example, works very well with the image data. So if you have like data in form of images of various diseases, and if you are trying to develop some kind of AI system with those images, most likely you end up using CNNs. But if you are dealing with speech data or text data, then most of the times you may end up using LSTM, or a combination of, like I have seen people using combination of CNN, LSTM methods. So every algorithm and every method has its own advantages and plus points.
Okay, thank you, sir. We have some more questions from our audience. Yeah. There's a question from Dr. Arindam Ballav. He's asking, for a dentist in the field of healthcare management, what is the scope of entering the field of data analytics?
So I know like my expertise in like dentist is not much. I go to dentist every few months, but other than that, I hardly know anything. But when I go there and sometimes they do the scan and take some pictures, so those kind of data obviously uh, can be used if somebody wants to develop. But even a dentist, like the example I gave about appointments. So actually today my daughter had an appointment at 10 o'clock with a dentist. And I called them around 8 o'clock that I'll be busy with this workshop today, so we cannot make it. So many appointments get canceled sometimes at the last minute. And any AI system that can work with that data and make a prediction that there's a likelihood that on a Monday by 10 o'clock, you may have 3 cancellations for the day. So even a dentist, those people, instead of sitting idle, they can in advance maybe call 3 customers and book appointments. So that way they can increase their output and be more efficient. So there are many different types of possibilities that may exist.
Okay. So, and sir, what would you like to advise on this CRISPR DM technology, the usage of this technology in the surveillance techniques of COVID pandemic?
Yeah, so CRISPR DM is actually a process.
Okay.
It's not really a technology like a machine. It's not machine learning algorithm or something like that. So it's the process where you start with, like if you want to develop if you're looking to develop a solution, AI solution or machine learning solution, so it always starts with the business understanding. So if we are looking at like data coming from dentists, so you have to understand the context and then what kind of data is there? Is it a text data, image data, whether there is a response variable so that we do supervised learning, or there's no response variable, we have to do unsupervised learning. So understanding the data, whether they are like mostly factor variables or numeric variables. So are there any missing data? So understanding the data, we have to see whether there is a missing data or not. Sometimes like people forget to enter some data in the computer and we may not have information. And then data preparation. So if you have unstructured data like image or text, then you have to do some extra work to convert them into structured format so that you can do some kind of model building. And depending on the data, depending on what you have done under data preparation, you may pick up several different options. You want to try, let's say, random forest, you want to try CNN, you want to try GAN, and then build a model, and then test and evaluate that model, see if it works. So sometimes we may have to go back from each step. It's not like step 4 is done and we don't have to go back. Sometimes from step number 5, you may find that you have to go back to 1. So there's a lot of back and forth before something which is like workable comes out, and then we deploy. So even deployment can be very tricky. Like I'm working with a company in New York, and we went through all the stages. In fact, 1 to 5 stages were like relatively easier to work on. But when we reached stage number 6, deployment, we started getting a lot of issues, a lot of like incompatible things happening between Windows and Mac and other things. So our solution like will behave in one way on a Windows computer, another way on a Mac computer, and some other way on smartphones. So we had to work a lot to make that process like consistent across different platforms. So this is a process where you can develop AI solution or machine learning solution going through these 6 phases.
Okay, sir. So I think that we can make out that it is a process that that can be used in various applications, like for predicting technology, or whether we want to use it for some vaccine development kind of thing.
Yeah.
Okay, thank you so much, sir.
Yeah, just like we have this Six Sigma process, like
Yes, yes.
DMAC, define, measure, improve, control. So similarly, in data mining or these kind of machine learning methods, typically people use this process.
Okay, thank you so much, sir, for answering the questions. Now we
Yeah.
can move towards the workshop, our
Okay.
workshop.
Yeah.
Thank you.
So I'm going to stop sharing this screen and I will go to R. So I hope participants got a chance to make their R and R Studio ready. So do you know if participants are familiar with R and R Studio?
Yes, sir, they are.
They are, okay.
Yes, sir.
Okay, that's good then. So, and I also shared R Studio Cloud for people who do not have it on their computer. So instead of installing, they can directly work through browser. So let me share my screen. So this is the workshop part, and we'll be working for next, oh, it's almost 10. So because I know there's a speaker starting at 10, right?
Yes, sir.
So you want me to stop? I can probably send some links. People can use that because I don't want to like.
Okay, sir. Okay, sir. Sure. You can share the links.
Okay, and then the participants can practice with them. So they have like all the step-by-step things, like how to get latest COVID data, how to do some basic visualizations, and then how to make a prediction. Like for India, I ran these predictions, and by end of July, the prediction as per like current data is about 1.3 million cases.
Okay, sir.
Yeah. And I
Thank
think
you so much, sir. Yes, sir. Thank you so much for sharing the wonderful insights and the intellectual session that we have. Now, I would like to over the session to Dr. Shivani Rao.
Thank you, Dr. Himani. Thank you, sir, for this insightful session. Before starting, I would request all the attendees to please download study material from the comment section uploaded by Dr. Prashant. Now, when we have reached so far in learning AI, we have really got a sense of what is AI, machine learning, deep learning, and data sciences. We have discussed case studies related to that. Now, further moving on in the journey of learning AI, I request Madam Monika Wahi to please explain much more in detail what are the best situations, case studies, mechanisms of developing AI in healthcare. Also, ma'am, if you could help us in understanding different challenges and issues related with this.
Well, hi, everybody. Thank you for allowing me to do the webinar, and I'm going to share my screen. First, in your materials, you'll find that there is a lecture called Wahi, that's my name, AI in Healthcare webinar, and that's the one I'm going to start with if you want to follow along, okay? So Dr. Rai provided a really nice explanation of a lot of things that will connect with what I'm going to talk about. I don't know why I can't get this thing away. Can you guys see my screen with the presentation?
Yes, ma'am.
Okay, great. All right, so considerations with applying artificial intelligence in healthcare. Oh, I guess I have to, let me see here. I'm sorry, I'm not very good at using, I'm just gonna have it not on the share screen because I just don't know how to use Zoom very well. I guess I'm not very good during COVID-19, right? So let's see here. Okay, so the learning objectives why can't I move this? Okay, here. The learning objectives of this lecture I'm going to do are at the end of this webinar. Well, actually at the end of the whole webinar, you should be able to explain what training and test means in AI algorithm development, which you probably already know, but we'll go over it. State 2 problems in AI that can be introduced by classification issues. Describe a known bias in healthcare equity in their country's healthcare system, and state how that bias could be amplified by poor use of AI classifications, and describe a strategy for preventing bias in AI classification and explain how that strategy would work to prevent bias. So this is an outline here of everything we're going to do together in this webinar. First, I'm going to do a lecture where I just kind of set everything up for you about what I'm going to talk about or what we're going to focus on. Because as Dr. Rai pointed out, there's just so much to look at in AI and in healthcare and in AI in healthcare. So I'm going to really just focus on one little part of it that's kind of generally really important. So you can come away with some deep dive into something kind of important in AI and healthcare. So in the lecture, I'm going to cover the best situations, like the introduction said, the best situations for applying artificial intelligence in healthcare. It doesn't always work perfectly, and I'm going to talk about places where it works really well. And actually, Dr. Rai talked about one of them where it works really well. And then I'm going to get into a case study of AI in healthcare that was IBM Watson, which you may have heard. Then we'll be done with this lecture, and I'm going to start a mini lecture explaining our exercise, which we'll all do together. It doesn't matter that there's hundreds of you on the webinar, because I'll just look in the chat, your question and answer, to do some interaction with you. But we're going to do a simple exercise together that will explain, that will show how, the choice of the training data set and personal biases in labeling classification and challenges to translating, ideas you have into actual concepts you can put in the AI algorithm. Those things, we're going to just kind of bring them out so you can think about them. And then I just wanted to kind of introduce myself. My name is Monika Wahi, and I'm from the US. I was born in Minnesota. Now I live in Boston. And I was happy to see that Dr. Rai is a neighbor. He's at UMass Dartmouth. So I'll have to follow up with you and say, hey, neighbor. I actually have a business. I was a professor, but I quit that job. Now I'm trying to be a professor somewhere else. But I have a lot of background working at the government and working at research nonprofits. I'm an epidemiologist by training. I was so happy Dr. Rai mentioned biostatistics. I'm very good at that, along with informatics. And on the slide is a bunch of information about me. And then what my company does is I do a lot of research coaching and teaching of research and academic coaching and in colleges of professors, because sometimes they are not quite as competent as Dr. Rai, who has all these students and does all these projects. Sometimes they need a little help, and so that's what my business does. All right, so don't forget to give me a call if you ever need help. All righty, so first I wanted to just really step back and point out where AI doesn't work in healthcare. And where AI doesn't work in healthcare is where human intelligence works better. So if you think of our brains are pretty cool. And there's a lot of places where our brains are probably going to be better than a machine. Okay. But as Dr. Rai pointed out, there are places where you just don't really need it. Like with the TAs, there's some routine questions TAs ask. I agree that you could use an AI algorithm to answer. So, but I taught a statistics class to nurses, undergraduate nurses, and there were some questions that you couldn't have answered with an AI algorithm. So it really depends. Okay. So that's my generic answer is wherever human intelligence works better, don't bother to build an AI algorithm. And what surprises me is that in healthcare, the early studies, like starting in the 90s and the early 2000s, were all about trying to build AI to replicate diagnoses or even treatment recommendations. These are done by doctors, and these are challenging for doctors. I'm not a doctor, but I have a lot of doctor friends, and they can be very challenged by diagnoses. So why people started by studying, AI for that function, I don't really know, because it probably wasn't going to work. Where it is going to work is in those places. Here, I'll do the next one. These two criteria there, 1 and 2, I didn't invent them. I got them from, and I'll talk about it later, a podcast I listened to where a person, a leader in the field, was talking, and he suggested this. He said that AI in healthcare is best where the decision space is small, like you're deciding yes, no, or just a few different choices of the decision, and where there's not a large human penalty for a bad decision. Like, should we route, like good examples down here, routing healthcare work. Like my friend's a pathologist, he works in the labs, and pathologists might be part-time or full-time. But if as soon as you like slice up a tumor, it has to be read, it has to be processed. So, so maybe some AI algorithm to better route that work, or responding to non-emergency patient inquiries, kind of like the TA response, or like one I've seen is identifying individuals at high risk to provide extra support system or services, like in case management. So like you can see in the picture on the slide, imagine that person's doing case management of chronic disease patients, diabetics, post-cancer patients, where they're calling and trying to make sure that they're complying with healthcare. Then it might be useful to run an AI algorithm on that database and try to find, identify people that maybe could use enhanced services. So it's like you're adding value using AI in healthcare rather than, trying to replace somebody or some function. So now I'm going to talk about the company DataRobot, and I have no affiliation with this company. I'm just kind of like a fan. The reason I'm a fan of them is because I think they're very ethical. Okay. I think they have their act together. So what they did is they invented an AI development platform. So that's kind of like, if you can think of like WordPress as a blog platform, that kind of helps you write HTML in the background. Well, I've never used DataRobot. I've seen it. I think I've seen screenshots of it or somebody demonstrating it, but it's a platform like that, which helps you take in your data and develop AI. Okay. And so I listened to this podcast. Oh, and by the way, I included a list of sources, a Word document in your materials, and all of these links of what I'm talking about is in there. So you can go get it. I just didn't put it on the slide. And okay, so this podcast, I encourage you to listen. It's not very long. Data science fails, ignoring business rules and expertise. And also, let me call out Data Science Central is a mailing list you can get on where people publish articles, and I just think it's really good. I don't know how I found it, but it was Data Science Central, that place that interviewed this Colin Priest, the vice president of AI strategy and a data scientist at DataRobot. So I love the interview. I think you guys will love it too. So DataRobot gave the example of a successful AI implementation they helped a company with. It was a car rental company. They wanted to do a better job of predicting who's going to get in an accident and cost them money. So DataRobot not only gave them the platform, but sort of helped them use the platform to come up with an AI algorithm to do a better prediction and maybe increase the cost for those risky people. And they actually followed up and studied it and found that they were saving them money. So they did better than whatever was going on before. That's a successful AI algorithm implementation. All right. So at the same time on this podcast, the speaker did a critique of AI in healthcare, specifically IBM Watson. Now, just a lot of you may know about what happened with IBM Watson, but I'll just give you a quick background. So IBM, we know, is this big famous, long-term company. Well, they decided to create this AI like algorithm or bot called Watson. And it wasn't created for any specific purpose, but more experimentally just to see if they could do AI. So what they did was they decided that they were going to sort of publicize it by putting it on a game show called Jeopardy, which some of you I'm sure are familiar with. So how Jeopardy works is there's 3 contestants and they are asked trivia questions like, who is the president of the United States in 1952? Something like that. And then people hit a button, and whoever hits it first gets to answer. And if they're right, they win points, and then, people win, and they'll win for multiple shows. Okay. Well, what happened was they wanted to make Watson win. They wanted to make IBM Watson win and then be famous, their invention be famous. So they did. They took, like Dr. Ray mentioned, they took natural language processing or NLP using the trivia questions, banks of trivia questions, and trained IBM Watson. So IBM Watson, what do you think? Won Jeopardy. It was pretty cool. So after IBM Watson won Jeopardy, everybody asked, well, could we apply IBM Watson in healthcare? And I'm not really sure why, but they said, yeah, let's start with images, like using x-rays and scans. Now, when you've been training it with NLP, why would you suddenly switch to images? Because that's what you're good at. But anyway, they did. And I'll just cut you to the chase. It didn't work. Okay, it didn't work. It maybe could have worked. Like Dr. Ray pointed out an example with the breast masses that can work. But there were a lot of problems with what they tried to do. First of all, if they had tried to just study breast masses, they probably could have gotten something. But they tried to study a bunch of different, they tried to have these training data sets of a lot of different images for different kinds of masses and put them in. And as you can see on the right side, their training data sets were too small. This is what the data robot guy was talking about. The training data sets also were fabricated. They weren't even real images. I'm like, who thought of that? And another problem was they didn't use humans to label the images in the training data set. And I know some of you know about classification and labeling, some of you don't, but that's going to be our exercise today. So you're going to better understand how you can screw up the labeling, or how I shouldn't say screw up, how labeling can create unintended consequences. So the bottom line is, the reason they were developing this AI algorithm is they were trying to make treatment recommendations for cancer patients who were going through life with tumors and, trying to make the tumors shrink and all that. So they were trying to put these images in and then have treatment recommendations. But a few places deployed it and it was dangerous. Like their treatment recommendations didn't pass the smell test. They were wrong. So they had to stop using it, unfortunately. So I'm going to just summarize the challenges of AI in healthcare. So first, there's the challenge of selecting an appropriate use. Okay, one that meets those 2 criteria, that sort of that small decision space, and that if you get it wrong, it's not going to really seriously hurt or kill someone. Then next is selecting an appropriate training data set. And appropriate is a really loaded word. Needs to be big enough, needs to be based on the same kind of things it's going to be predicting. There's quite a bit of goes into appropriate. Next thing is properly labeling the training data set. And we're going to get more into that in our exercise. And finally, properly testing the algorithm to make sure it works. Now, the car rental place really did that. IBM Watson did not really do that. And so that's why I'm kind of a big fan of Data Robot, because when you go to buy when you go to buy like Microsoft Word, Microsoft doesn't come and make sure you do a good job writing. Data Robot, when you come to buy their platform, they make sure you don't start making some AI algorithm that is hurting people. You know, they sort of hold your hand a little bit. So I really respect them for that reason. Okay, well, on the right side of the slide, I said, well, what do these vocabulary words mean? And how do we do these things correctly in healthcare? Because that's what my exercise is going to be about. But I'm sorry, I got two screens here. I'm not really good at using it. What I want to do is stop for a moment and just take some questions before I continue with our exercise. Does anybody have any questions? I'm looking in the question and answer.
A very good evening, ma'am.
Hi, yeah, are there any questions before
Yes,
I go on?
yes, ma'am. Ma'am, there is a question from most of the participants that the people who are not into data analytics, or the people who are who don't know how to code the data, how they can enter into the field of artificial intelligence in healthcare.
Well, the field of artificial intelligence is sort of a step up. That's like asking the question, I want to become a plastic surgeon. Well, first you have to become a doctor. Then you can become a plastic surgeon. Okay. So before you get to artificial intelligence, you have to become something that comes before that. Now, what can come before that? Well, things change a lot. What I've observed from backing up is the people in artificial intelligence are often engineers, okay? But if you're not an engineer, then you don't have to be an engineer, right? Like I'm from public health. I learned biostatistics. I gained skills in informatics outside of public health. Like I just pursued that. And so together with biostatistics and informatics, and healthcare knowledge, subject matter knowledge in healthcare, I could go into artificial intelligence, okay, or data science. You know, data science is sort of a watery term. But, oh, you know, some of you were talking about dentistry. I know a lot of actually dentists. And how dentists sometimes get to artificial intelligence is what I learned about dentistry is there's a lot of surgery in it. You guys have a lot of medical devices. And what often you will, and you're subject matter experts. And so often what you'll do is learn better statistics and public health and become inventive and team up with engineers and innovators. And that's where you get towards artificial intelligence. So the way I want all of you subject matter experts, nurses, doctors, business people who don't know how to code to see it is that people like me who know how to code, like the dentists I met, they had to teach me. They had to teach me how to use, like they had to teach me the numbering system of teeth. I didn't know teeth had a numbering system. They had to teach me what periodontitis was. I didn't know what it was. We didn't learn in public health. And the risk factors and what are the issues, what is peri-implantitis. And then I started realizing, like right now, it would be really nice to use artificial intelligence on people who have dental implants to predict those who are at high risk for peri-implantitis. This sounds very jargony to people outside of the field of dentistry. If you're in dentistry, this sounds very normal. But I came to this without any AI. I came to this by just subject matter expertise. So I guess my short answer is, it's nice if you can learn how to program. It's nice if you can learn how to handle data and understand data. But the reality is other people are going to be better at programming because they do it all day. Engineers are going to be better at engineering, building things. But if you're in the healthcare field or you're in the business of healthcare, you're a subject matter expert and you need to learn how to direct these people and guide them and tell them what to put in their AI models and what to try and predict. And that's sort of where you can fit into the field.
Okay, ma'am. Thank you for such nice elaboration. But I'm having an extended question over this. Like, what skills do we need to be in the industry related to the the non-coding people, if we want to enter into this industry of data analytics, or like you said that we can direct them or we can instruct them to do the coding because they are better in coding rather than us. So
what skills do they need? Well, I would say
do we need it?
Yeah. So number one, you need data curation skills. Number one, anyone can learn them. Anyone can learn them. Anyone who handles data, even if you can't analyze the data, if you can open a spreadsheet of data and look at it, you can learn them. I have a LinkedIn Learning course in it that you guys can take, which is pretty good. People are liking it. Okay. I haven't found any other thing that teaches it. You'll like my course if you want to learn data curation. Okay. And after you take that course, you'll understand why supervisors want that course, because it's a good way of communicating using documents and spreadsheets to your programmers what you want them to program, okay, without even doing any programming. Then next, you're going to want to learn good management skills. And by management, I don't necessarily mean leadership, although leadership is good, you know, inspiring people and, you know, being able to console people, being compassionate. That's good. Definitely learn that. But by management, I mean, like, let's say you have a project and you need to get it done and you have 3 employees. How do you sit down with them and maybe make a spreadsheet that makes a list of all the tasks and assigns them to the employees with them and helps them hold themselves accountable for the task? How do you keep track of, like, let's say you're working with some other people outside and they have some specifications, maybe for an AI algorithm. You know, how do you keep track of those specifications? So sort of like project management skills, but also just plain management skills. How do you make things clear? Like, I'll tell you a stereotype. It's not totally true, but programmers don't like to go to meetings. They don't want to be interrupted. They like to put on their headphones and listen to music and do their work. This is a stereotype. Some programmers are not that way, but a lot of them are. And so how do we minimize meetings with them, make the meetings useful, and create a lot of documentation so they can just look it up while they're programming? You know, these are the 2 sets of skills, data curation and management, which both of them are basically connected. That's what I would focus on. And if you're good at that, you will produce a lot of papers because you'll just direct other people to produce papers. Like, I'm thinking of a person at Harvard who he does not program at all, but he directs a person and she directs a lot of programmers, and they produce a lot of papers about some surveys they do about mental health. And so that's how he is famous in this field.
Okay, ma'am. Thank you so much for giving us such a lesson or such a beautiful advice that how we can move on with our careers. Now over to you, Shivani.
Hello, ma'am. Ma'am, there is one question from the audience. That is, what is the scope of blockchain technology taking over AI in the terms of healthcare?
You know, it's interesting you ask that. My friend made me go to a blockchain meetup just before COVID-19 came and we had to stop doing meetups. The blockchain meetup was at MIT, you know, Massachusetts Institute of Technology, because I live right by it. I didn't really want to go, but my friend said, you have to go. Blockchain is the new thing. I'm glad I went because the panelists talked about different blockchain deployments in other countries. And basically what blockchain can do is you can send information securely and get it confirmed, right? Like in an electronic way, which sounds attractive to healthcare. But I'm older now. And in the US, HIPAA, which is a law that started in 1990, you know, 1990, we had a lot of paper. We didn't have as good electronics. They were trying to simplify like electronic transmission of healthcare data in HIPAA, in the rules that were made. And so I asked a question in the panel. I said, you know, is blockchain the new HIPAA? Like, we're trying to simplify this even more. And interestingly, they were very smart in their answers. Interestingly, they gave an answer very similar to my answer about AI in healthcare, which is not the same thing at all, but it depends on the scope, right? Like, they described doing a lot of work. I think it was in Estonia, just being able to do, like, take their public hospital and do billing and get paid from the government using blockchain. It was just tons of work, you know? And I was thinking, you know, that's true. After HIPAA, we had to do administrative simplification, try to do some electronic billing. It was tons of work. I mean, we're still doing it. It was worth it, but I don't know if it's going to be worth it with blockchain. So that's what they all said at the panel too.
Thank you, ma'am. Ma'am, do you see that it is different in both the developed countries and developing countries if we see the scope of AI?
Well, here's the problem. Okay. AI can only be made after you've done a certain amount of homework, which actually Dr. Ray touched on. Like, you have to really make sure your AI model works. Okay. So think about that. What is an AI model? It's something that you put inputs in and it puts a prediction out. Well, what if you don't have those inputs? If you try and imagine COVID-19 around the world, imagine some countries, they don't have that much data on what's going on. They're low resource countries. So if you're going to be a low resource country, you really don't have a whole lot of data on you. What is AI going to do? You know, you really can't fit anything. So what I see for lower resource countries is R. Like you know, though a lot of you don't program, but if you don't program, you know, I encourage you to learn R or Python. Somebody in the chat was saying they prefer Python to R. You can learn both if you want, but I think you should learn one or the other. R, I know more about because I know it, and it is open source, meaning it is free. So if whatever you do, if you develop it in R, and R is very extensible, if you're in a low resource situation or you're in a high resource situation, like I work a lot with customers from Saudi Arabia, they have enough money, but if they want to connect with like Egypt, okay, that's a low resource place. So why don't we just develop everything in R so we can afford it? Like SAS is a competitor to R, very expensive software.
Thank you, ma'am. So we can move forward.
Okay, let's go on to the, thank you very much for doing these questions here. Now we're going to go on to the, I'll close this. We'll go on to the exercise. Now I'm going to open the other lecture slides that say AI exercise. Okay, can everybody see my screen?
Yes, ma'am.
Okay, great. So we're going to do this exercise in 2 steps. Okay. Step 1 is labeling the training data set of images. Okay. So we're going to pretend that we're going to be making an AI algorithm. So this is the first step of AI development in all fields. So in natural language processing, remember how Dr. Ray showed those 2 examples of like chocolate and how he was talking about how like and chocolate were far apart in the second statement? Well, if I'm trying to develop an AI algorithm that identifies people liking chocolate in a bunch of text, then I'm going to have to go through and do sort of highlight and create these tokens. I think that's what they're called, of things that mean that you like chocolate. So if I say, you know, many people like chocolate, but I don't, well, that's not liking chocolate. So I would have to, you know, do this labeling step. Okay. But we're going to do it with images. Now, remember, Dr. A talked about issues with a training data set where images were labeled. We're going to do our own labeling, right? So this is our simple exercise. We're just going to use 3 images, but AI in general works like against these labels. So if you've ever been on Amazon and you looked up a book and then right next to it, it's suggesting other books, basically it's matching classification labels between the book you looked up and the other books. Same with Netflix if you're looking for a movie. Same with YouTube as you look at videos. That's what it's doing. And so we're gonna use images, and when we're gonna apply the labels that you gotta think in your brain are later going to be used as matching to try and predict a new test image of what it is, right? Like what it groups with. And how we're going to do this labeling exercise is we're going to fill in a little Excel spreadsheet I gave you. And then we're going to pull together and talk about what labels we use. Then after that piece of the exercise, we are going to apply our AI labeling algorithm to a test image, just one test image. And I'll show you how. We'll do this manually, no programming. Okay, we'll just manually do it. And then I gave you a little worksheet in Word with 4 questions on it, just reflective questions to answer about the exercise and to reflect on the experience, and then and discuss it. Okay, so so one of the main foundations of AI is classification. You guys seem like you already know a lot about it, and you probably already know that. So classifying means literally classifying data variables as having some sort of value to the AI algorithm. So if you think of the car rental example from Data Robot, imagine you go rent a car. Think of all the data they have on you, okay? Maybe there's some variables like when your credit card expires, maybe that's not that important to whether or not you're going to get in an accident. But maybe if you're like a repeat customer, maybe if you've gotten in an accident before with them, with their rental cars, maybe that's like a risky variable. You could classify that as risky. Or maybe one of the things I was thinking about might be associated with reducing risk is always being up to date, like always paying things up to date, being up to date on your license. But you have to look at the variables you have in your database that you can use to do the prediction, right? And then to execute the algorithm, the company gets the information from potential customers, matches against this classification to predict the riskiness of the customer, and that's how they calculate the cost. And I just want to remind everybody of GIGO. Remember GIGO? Garbage in, garbage out. This is true of computers, especially true of AI algorithms. If you put garbage into the AI algorithm, you're going to get a bad prediction out. So like I said, translation for AI, bad classifications, if you put that in an AI algorithm, you're going to get bad predictions out. So like that AI algorithm Dr. Ray talked about that predicted that Black people were gorillas, bad classifications in, bad predictions out. So I have 2 other examples of AI gone wrong, and I have links in my sources list I gave you of these. One is in corrections and policing in the US. The variables that were classified to predict reoffense or like dangerous criminals that are going to be dangerous in the future, they were basically variables that mean being Black or brown. So they were, race, they were racist. So they were basically saying, oh, if you're Black or brown, you're more likely to reoffend, you're at higher risk. Okay. So this is a classification problem. Another bad AI algorithm was used in hiring. This was actually at Amazon. They found the algorithm when they sort of looked into what it was doing, they were finding that whenever what it was doing is sorting resumes. And whenever it found on the resume anything to do with woman stuff, like women's studies majors or women's softball or anything, it was sorting it into risky or bad. And what do you think? Sexism. Okay. So how did it get that way? What is the cause of this? Well, studies have shown that actually mostly white men are involved in the labeling and development of AI algorithms globally. And that creates a bias in the labeling, and the bias becomes amplified when the AI is applied. But I want to emphasize white men are not the problem. The problem is homogeneity. If they were all Black women, we'd have biases of Black women. I don't know what they are, but we'd find them out because they'd be amplified by the AI they develop. So it's really important to have diversity of people involved in your labeling. Okay. And so how does this relate to AI, healthcare AI? Like I just said, you need a lot of different perspectives in labeling. And we've already seen so many biases in healthcare without labeling, like with human intelligence. In the US, Black people get treated worse than others. And study after study shows this. Like one study, women who have breast cancer, diagnosed with breast cancer, white one, Black one, otherwise the same. White one gets recommended to good treatment, the Black one just sent home. Study after study shows this. And so if these same people who are running healthcare in the US and doing these racist things are also doing the labeling in healthcare AI, it's going to amplify the bias. So the objectives of this exercise is to give you an experience of trying to apply labels to a training data set that will be later used in this manual AI algorithm, which, you know, will apply manually, just to show you like how hard it is. Because it really, now that I've bashed everybody, it really actually is hard. Okay. And you're going to look at, then be able to see your personal biases, because there's so many of us here. We're all going to put different labels on, and then we're going to sort of see stuff about ourselves. It's going to be kind of fun. So I wanted to talk to you about 2 folders of materials I gave you. I gave you an image folder, and inside that image folder are the images that will be used in this exercise. Then I also gave you a worksheets folder. There are 2 things in there. The step 1 worksheet, which is called labeling worksheet, which is a spreadsheet. And that's going to be used right now, what we're going to do. And then after that, in step 2, there's test images questions worksheet with 4 questions on it. And that's in Word, and we're going to fill that out in step 2. All right. In the images folder, there's an example image, which you don't need to use. I just included it for example. Then there are 3 images, image A, image B, and image C. And those are the training images. Then there's 1 image called the test images. Okay. And I also included this slide here with all of them together, because this makes it a little easier for you to look at them all at once, which we'll need for the second part of this. But for the first part of this, you might want to open the images individually just so you can look at them close up. So images A, B, and C are the ones you're going to apply labels to. Okay. And the test image is the one that you're going to apply your labels to do the AI prediction. Okay. Now, if you're wondering how to do this, I did an example just for you. You don't do this example. I just wanted to show you how without like disturbing the exercise. Okay. If you open your worksheet, labeling worksheet, and you go to the example image tab, you'll see exactly what's on my slide here. And if you open the example image, you'll see this over here. So how do you label this image? Literally, I just put whatever came to my mind. So the first thing I saw is a woman, and then I saw a computer, and then I saw she had long hair, because you know what? I have long hair. And she has black hair. I have black hair. And I thought she looked young. I don't know. Maybe she's not young. I see her from the back. I think she's young. And if you look closely, you know, she's got glasses. She looks like she's in an office. I saw this medical equipment. I think she's working. I saw these 2 monitors. Nah, I think it's daytime. Maybe it's not daytime. I decided she was married because I saw this ring here. Okay. And I think she looks very professional. Now, I have a background in cardiovascular epidemiology, so I saw this and I thought maybe this is an ECG. So I put cardiovascular and cardiologist. And also, I just love her hair. I think it's beautiful. You know, she's beautiful. And this is a workplace, right? So you might see totally different things in this. I mean, you'll probably see woman and computer maybe, but I don't know if you'll come up with the same list. Okay. And you might come up with like a longer list or a shorter list. But this is our first exercise. Is what you're going to do is you're going to go to the training images tab in the labeling worksheet and see this image A, image B, and image C. Just open them up and just go putting whatever labels come to mind. And it doesn't matter the rows, like just list them, whatever you want, however many you want. Okay. And this is kind of like the instructions, you know, from the worksheets folder, open the worksheet called labeling worksheet and go to the tab training images, and you'll see the 3 columns. And then from the images folder, open the images. And then in the spreadsheet, just type in a list of labels that you would formulate for each image. Now, here's the trick. Try to reuse labels as often as possible. So you see how I said woman? Like if I see another one and I want to say lady, let me say woman instead, just to try and minimize the labels and make them cross. So I'm going to give you 5 minutes for this exercise. Let's see here. On my clock, it's 10:43. So it's something 3 for you guys. So let's see here, 10:43. So 10:48, we're going to stop, and I'm going to ask you questions. We're going to look in the chat and see what kind of labels you did. All right. And if anybody has any questions, I don't know how I'll handle it, but if there are any questions about the exercise, somebody please ask me and I'll tell you if you're confused or anything. Oh, one says I did not follow the third.
There are a few questions related to application of AI in public health.
I'm sorry, you're cutting out a little. AI in public health, you want me to talk about that?
Yes, can you please elaborate?
Okay, well, I'll just tell you that public health is suffering. If you look at COVID-19 and the world response, many well-resourced countries, including my own, are not responding well. Even with classic public health, like we know basic stuff, we know contact tracing, we know how to do that. We know testing, we know screening, but we didn't do it. We undervalue public health. We're in such a turmoil that it's hard for me to see where AI is going to fit into public health. I would like to back up and just tell everybody that innovation is going to happen in public health. I don't know what it will look like. It may have AI components, but innovation needs to be there. We need ways of screening for COVID-19. We need ways of finding out if COVID-19 is inside of a space, how infected it is, how effective cleaning is. And forget about COVID-19. We need to find out better ways of teaching remotely. Here we are on Zoom, but is there a better way? Just so much innovation. And this is public health, right? Even our public health workforce is changing, and what we need to know and be doing is changing. And so innovation is the key. AI is not exactly the key. You might find as part of the innovation that you're doing AI, but it's innovation. I thought I saw somebody wasn't sure what to do for the instructions, and I'll just say, see this image here, which is the example image. See how I made up these labels about that image? What you do is you open image A and you write labels that you make up about image A. Then you open image B and you make up labels here and type them into your spreadsheet about image B that you think of, and try, if there's any labels that are sort of similar to image A, copy them so you repeat them. Then finally open image C and do the same thing, list the labels for image C. And if there's any duplicates between these, just add that one. Try to keep similar lexicon. Does that help? Oh, okay. Well, we're at 10:48 now, so I'm gonna move on here. Okay. And so so I made here, I can move this here. I made a slide where I showed you what my labels were, and my labels are gonna be different than yours. But I was gonna ask you guys, did you think it was easy, or did you think the labeling was hard? In general, what does everybody say? Was it easy or hard? Or just, you can type into the question and answer what your experience was. Anybody can say, what did you think? Maybe some of them were hard and some of them were easy, or maybe you didn't know what to say. Some people get writer's block. I know with mine, I could see that the fact that I have a friend who's a pathologist. Oh, Ajil says that it was easy. Okay, why was it easy, Ajil, for you? See, I have a friend who's a pathologist, so it was easy for me to come up with stuff about the lab, like this blood and laboratory technician and stuff, because I've worked with him so much, and that was on the brain. Easy, but focused more on, so one person says easy, but I focus more on environment than individual traits. Aha, very reflective. Okay. So by me showing you mine and then you looking at it, you're going, oh, I came up with different things, right? So that's what I was trying to show you, is that we're going to be diverse. Okay. So now what we're going to do is you're going to take your system there and we're going to do step 2. I want you to now open the test image. Okay. So this is a test image, this lady here, and it's called test in your images folder. And I also want you to go to the next tab in your Excel file, which is called like the test image tab, right? And what I want you to do is, this is the rule. You can only pick labels that you already used on A, B, or C to put on this image, okay? You don't get to make up new ones. And whenever you put a label there, list which images, like if it was just A, put A. If it was A and B, put A and B. If it was A, B, and C, put all of them. If it's just A and C, put A and C. And so that's the next step. So this is the instructions here. So open the test image, go to the next tab, and then make a list of the tabs, the tags you would apply, the labels you would apply that you already made. Now, if there was none, if you made ones and you're like, none of these apply to the test image, then just don't put any down. But probably there's a few at least. So go and put those down. And then after you're done with that, after you're done with your labeling, going through all your A, B, and C labels and putting them down and filling this out, and you're sure you caught them all, right? Because it's a little hard, it's kind of big. Once you're sure this is done, then what I want you to do is I want you to open the test image questions worksheet and answer the questions, just 4 of them. And then we're going to talk about those questions. All right. And we're going to get back together just in a few minutes. Okay. I'll just give you a few minutes for that one. Oh, and if anybody has, I'm starting to figure out how to use Zoom. If anybody has any questions about how to do the second part, go ahead and ask me.
Hello, Dr. Wahi, Professor Shweta here.
Hi.
My question is not related to this particular exercise, but it is actually related to how our students can make a career in product management space. Most of them are doctors, either they come from dental services or have done their MBBS
Make a career
degrees.
in where? In what exactly?
Product management positions.
Product management, like at an industry like that's making
in technology
like,
companies like Apple or Google or
well, this is what I would suggest. Okay. Step 1, if you're a clinician, step 1, think of an innovation that would improve your trade, right? Step 2, get a technology group together to create a prototype and make a patent and test it. And if you have trouble testing it, you can call me. I know how to make research tests for that, right? Then once you've got that prototype and you've got that patent and, you know, maybe you formed a little company, then you try to go to the industry that you want to be a product manager in and see that if you can sell that or get, you know, hired by the, you know what I mean? That's how you bring it to them, because that's how the industries want you, is if you're bringing them something.
Okay. I've got a follow-up question. Some of our students may like to have an internship in your company. So how can they have an internship with you? Because
you know,
we have about 5
of them. I love interns. Okay. But the problem is I have to invest time in them. So I try to only have one at a time, but I'd be happy to have interns. So please, on the slide is my email. If you're an intern or you want to be an intern and you're on this program, please email me, tell me that you're from this program and send me your CV or your resume in the email and say you're interested in an internship. And then don't be hurt if I don't get back to you right away, but I promise I will get back to you in July and we will discuss it and see if it's a good fit and what we can do. Okay.
Sure, thank you. I have got a similar question for Dr. Bharatendra, sir. Sir, if our students don't have technology background and they're not very strong in analytics, but still want to make a career in AI-driven products or services, what is your advice for them?
Yeah, so your question was students who are not really that strong in analytics. That's what you said, right? Or data science?
Yes, sir. Yes, they're not interested in learning analytics and data science because they have a little different bent of mind, and still they would like to uh, make a career in AI-driven products or services. What is the best way to make a career in the technology space for them?
So, frankly speaking, if you look at like any healthcare system, the people who have these data science backgrounds, so they become part of the teams that are working with data, but they still need people who have the those expertise, because data scientists, their expertise is mostly with data. So they can suggest like how the data should be collected, or what data should be collected, or how to work with the data and come out with some solution. But the technical details and other things, they still need those people on the team. So data scientists obviously cannot replace people who are technically strong, but they can work as a team and help with the solution, because it's not going to, like, one person is not going to come out with all the solutions in terms of like what data should be collected, what technical things something should have. So it's going to be a teamwork. So everybody can fit in that teamwork. But I would also say that having some understanding, some background is also important. It's nowadays you cannot totally ignore some basic concepts and understandings in the field of data science if you are working with those people. So having a basic understanding, like you may not be expert in, okay, how many neurons I should have in the third layer of my GAN network, or how many, what should be the metric that I should use to minimize errors. So you may not have those details. Maybe you need a data scientist for that. But the other technical details coming from that field in which this application is being made, so that's always most important. Data scientists can only augment that and complement those skills and experiences.
Okay. Thank you, sir. Because we are running short of time.
Yeah, can we wrap up the workshop part, because I just want to wrap up.
I request Dr. Wahi to wrap up the workshop.
Yeah. Oh, okay. Okay. Thank you. Thank you. So I just wanted to show you. So you should be done with the second part of the exercise. This is what I got for the labels that were in common and the images in common. And for me, I thought, I'm just going to jump back here. This was image B. I thought for question 1 on your worksheet is which image looks similar. I thought these two looked the most similar because she's got her arms crossed. He's got his arms crossed. They got kind of the same look on their face. It's not really clear what's going on here. Whereas these two are in the lab, you know, they're doing something active. This looks the same. Yet I realized that here, you see, you don't see B very often. You see a bunch of A. You know, I thought this person was more like this person, right? So why was that? You know, so the question is, like, was your human prediction more of the closest training image more accurate than your AI prediction? Well, some of you probably weren't like me. Some of you got the right one. Some of you got different ones. But like the person who was saying about the environmental labels, think about whether you got the same or different. Think about why and what it had to do with the labeling. Now, if you look back, if you're like me and you believe just with your human brain that these two should have come out, like this one should have come out as most like this one, I can go back and relabel these in such a way that that happens. And that's an example of how you iterate an AI. This is what Data Robot helps people do. this is how the car rental group eventually got such a good algorithm. So the question then is, what are the steps?
Dr. Wahi, for
What are the steps we can
Thank you,
take?
Dr. Wahi, for your great insights. Actually, we have time till 8:30 because of constraints of the IT team. They have some other another webinar lined up. So we would like to conclude, and I request Dr. Shivani Rao to conclude this session.
Okay, well, I was done anyway, so that was my last.
Yeah, thank you, Dr. Wahi, for your wonderful presentation.
You're welcome.
Thank you, Dr. Wahi, for this insightful session. I thank you. I think everyone would be clear about these issues, all the more details related to AI. So now we are heading to the end. I would like to quote by the Amit Ray, and the quote is, "The coming era of artificial intelligence will not be the era of war, but be the era of deep compassion, non-violence, and love." So I again thank both of the guests for enlightening us with their knowledge, and I would like to thank all the speakers and the guests. I would like to thank Dr. Shweta Agarwal for such a wonderful session, and thank you very much.
Sure, Dr. Rai and Dr. Monika, thanks a lot for giving a lot of good insights and as well as the career advices to our students. Most of students have given a very, very good feedback for this particular webinar. It is very, very useful to us. Thanks a lot for taking time from your precious schedule for this webinar.
And thank you very much, Dr. Shweta, for taking this initiative and organizing such a wonderful event.
Yes, thank you very much.
Thank you.
Thank you.